Hi, I'm Dr. Chantelle Paul, and as a chiropractic patient, being pregnant, 38 weeks, Back On Trac is a really great therapy for me that really helps with my low back pain and my SI joint pain. I love to utilize this because as we get bigger throughout pregnancy and lose our center of gravity, we lose core strength, puts more pressure on our facet joints, so we have that localized pain. The Back On Trac is a great way for me to open up those spaces, get inflammation down. It helps me keep my spinal strength too with the tractioning. So throughout the pregnancy, I utilize it for wellness before I have pain. In late stages of the third trimester, I love to utilize it for the pain that I do have. The cool thing about it too is the way that you start up seated and the amount of time that we utilize on it. For 8 to 10 minutes, I'm able to lay on my back without having the pressure of the baby on it, so it doesn't affect blood flow either. So it's a great short therapy to get that traction. My pregnant patients love it when they come in symptomatic, which is really great to utilize. So even if they feel great, I'll still utilize the Back On Trac because I want them to stay feeling great. So when it comes to being a practicing physician while pregnant, the great thing about the Back On Trac is I'm able to practice all the way up until I do have my baby. I typically don't take time off. So this is my third pregnancy and I've been able to work up until I've had the baby. And a lot of that does have to do with, of course, chiropractic adjustments in the Back On Trac. So when it comes to the doctor's side of the Back On Trac, I love having it in the office. Again, pregnant patients are limited on what therapies they can do. This is one they can do, so I love that. Outside of pregnancy, I love it for all my patients. We run 2 chairs all day long. We see anywhere from 25 to 30 patients a day on the Back On Trac on each of these machines. So when you're looking at incorporating this into your office, it's a great therapy to utilize for facet syndrome, sacroiliitis, even for disc bulging. It's a good alternative for decompression. It doesn't take up a lot of space, and your return of investment is really good. On average, I would say most chiros that have it, including myself, it's a 15 times return of investment. You pay these things off really quickly. This is a great therapy to have in the office while being pregnant, for your pregnant patients, but for all low back conditions. Very few contraindications of getting on it, which is also a blessing. So it gives those chiropractors the freedom to treat all their low back cases with the Back On Trac.